Dr. Harrison and Nurse Elena Rodriguez were approaching the most critical moments of a lengthy heart surgery. Dr. Harrison's eyes were watering from exhaustion and his hands had started to tremble slightly. "Elena, we need to finish this case quickly. We're both very tired." "I don't want to make any mistakes," he said breathlessly. At the most critical moment of the long and grueling heart surgery, while completing the vascular anastomosis, Dr. Harrison's face suddenly turned pale. Sweat beads settled on his forehead and he clutched his chest. "Elena, I can't breathe," he stammered. Suddenly, his knees buckled and he collapsed to the operating room floor. The patient's heart was beating irregularly on the monitor, blood pressure dropping. At that moment, Elena did something very different from the panic around her. She maintained her composure and glanced at both Dr. Harrison and moved toward the operating table. "I will complete the surgery," she said with determination. The other nurses looked at her in shock. "Elena, you're a nurse, not a surgeon." But Elena had already taken the scalpel in her hand because the operating room wasn't a foreign place to her. And in the next 3 hours, everyone at St. Catherine's Medical Center would learn who Elena Rodriguez really was. Because some people wear nurse uniforms, but actually have surgical training. Elena Rodriguez was St. Catherine's Medical Center's most reliable operating room nurse. The 31-year-old brunette had been working at the same institution for 3 years. She delivered flawless performance every shift, systematically prepared surgical equipment, and maintained perfect coordination with doctors. With her dark brown hair neatly tucked under her surgical cap, Elena maintained professional distance while still conveying warmth in her approach to patients. Her dark brown eyes carefully followed every surgical procedure and the steadiness of her hands gave confidence to the doctors. Elena's surgical team consisted of Chief Physician Dr. Harrison, Anesthesiologist Dr. Chen, and Assistant Technician Marcus Williams. Harrison was a respected 50-year-old doctor specializing in cardiac surgery with 20 years of experience. Chen was a meticulous 42-year-old specialist who had been administering anesthesia at St. Catherine's for 12 years. Elena's most critical intervention was saving a major severely wounded in a rocket attack. In her second deployment, she was with the Combat Surgical Support Team in Iraq, surgical support in urban warfare, emergency surgeries after insurgent attacks. The techniques she learned in these deployments were methods never used in civilian hospitals. Her third deployment was classified surgical operations at the Syrian border, surgical assistance in covert operations, medical support for special forces. Elena had now gained surgical expert-level competency in all types of geographical and operational conditions. Over 10 years, Elena had successfully completed 164 critical surgical operations. So why had she left the army to become a nurse? This story was more complex. PTSD, adaptation problems, civilian life challenges. Elena's transition hadn't been easy. High-pressure surgical work felt familiar, but civilian procedures were different, and this tension would explode that day. After receiving an honorable discharge in 2021, Elena had transitioned to the civilian healthcare sector. She used PTSD rehabilitation, adaptation counseling, and career transition support. Operating room nursing had been an ideal choice. When St. Catherine's Medical Center hired her, Elena was overqualified. Nursing degree, 10 years of military surgical experience, field surgery certificate, but the hiring committee hadn't asked detailed questions. "I've always wanted to work in the operating room environment," Elena had said, and this time she was completely sincere. Daily work was comfortable compared to combat surgery, surgical preparation, doctor assistance, patient care. But Elena was doing much more. She evaluated every case from a field surgeon perspective. "Elena, how do you understand surgical procedures so well?" her colleague Marcus would say. "Observation," Elena would say, "every surgery is educational." When her Tuesday evening shift began, St. Catherine's Medical Center had an intensive surgery schedule. 3 complex operations were planned consecutively in the cardiac surgery department. Dr. Harrison and Elena had started working nonstop from 9 a.m. The first surgery was completed in 6 hours. Triple bypass surgery successful. The second operation took 4 hours. Aortic valve replacement flawless. When the third and most challenging surgery began, it was past 8 p.m. 49-year-old Patricia Lynch's condition was critical. Multiple vessel blockage after massive heart attack, complex reconstruction surgery was required. This was the most dangerous operation of the day. Dr. Harrison and Elena had been working non-stop for 11 hours. Signs of fatigue were clearly visible in both. Dr. Harrison's hands were slightly trembling. Elena's reflexes were also slower than normal. "Elena, we need to finish this case quickly. We're both very tired." "I don't want to make any mistakes," Dr. Harrison said, struggling to breathe. Elena assessed the situation. Harrison's condition was concerning, but Patricia Lynch's life was in danger. "Doctor, I can help. We'll handle this together," she said in a supportive tone. When Patricia Lynch's chest was opened, the severity of the situation became apparent. Extensive damage to the heart muscle, complete blockage in 3 main coronary arteries. This surgery was one of the most challenging cases in Dr. Harrison's career. "Elena, this is very complex," Dr. Harrison said while sweating. 3 different bypasses and myocardial repair are needed." The surgery began. Dr. Harrison's experience kicked in, but fatigue was also taking its toll. His hand trembled slightly while placing the first bypass graft. "Doctor, would you like to rest a bit?" Elena asked with concern. "No, we must continue." "Patricia can't wait," Dr. Harrison said stubbornly. In the second hour, the surgery became even more difficult. The damage to the heart muscle was larger than expected. Dr. Harrison was constantly wiping sweat, having trouble breathing. By the end of the third hour, they had reached the most critical stage. They needed to complete the final vascular anastomosis. Patricia's heart was beating irregularly on the monitor. "Elena, this last connection is very delicate," Dr. Harrison said with the scalpel in his hand. "We can't make any mistakes." At that critical moment, Dr. Harrison's face suddenly turned pale. Sweat was dripping from his forehead, and he pressed his hand to his chest. "Elena, I can't breathe," he stammered, fear in his voice. "Doctor!" Elena's voice echoed through the operating room. Dr. Harrison fell to his knees, then collapsed to his side. He was having a heart attack. Anesthesiologist Dr. Chen rushed to Dr. Harrison in panic. "Acute myocardial infarction. Life-threatening situation," Marcus screamed. "Both patients will die. What are we going to do?" Patricia Lynch's heart was beating irregularly on the monitor, blood pressure dropping rapidly. She had been left in the middle of open chest surgery. At the same time, Dr. Harrison lay unconscious on the floor, his pulse weakening. "The nearest cardiac surgeon is 45 minutes away," Dr. Chen said, "but neither of them can wait that long." Elena's mind calculated within seconds. Patricia's heart would stop within 10 minutes. Dr. Harrison had also suffered a heart attack. 2 people were about to die. At that moment, Elena remembered the most important rule her 10-year military training had taught her. In a multiple casualty situation, determine priority. Move quickly. Don't lose anyone. "Dr. Chen, start CPR on Harrison. Marcus, get the defibrillator." "I will complete Patricia's surgery," she said in a commanding voice. Dr. Chen looked shocked. "Elena, you're a nurse. There are 2 patients. One had a heart attack. I won't lose either of them." Elena's voice resonated through the operating room with power and determination. She quickly put on surgical gloves. Her 10-year field surgery training had kicked in. This was the multiple casualty management she had learned on the battlefield, saving multiple dying patients simultaneously. Chen, while performing CPR on Harrison, report his vital signs audibly. "Marcus, keep both the defibrillator and surgical instruments ready." Elena looked at Patricia's open chest. The final bypass connection was left incomplete. The heart muscle was damaged. Irreversible damage would begin within 10 minutes. When she took the scalpel in her hands were no longer trembling. Her eyes were no longer tired. Staff Sergeant Elena Rodriguez had taken over. "Harrison's pulse is very weak," Chen shouted while performing CPR. "Blood pressure critical." Patricia's last bypass connection completing, Elena said while simultaneously performing surgery and monitoring Harrison's condition. Elena's hands were dancing between two different tasks. 1 second the anastomosis in Patricia's heart. The next second checking Harrison's pulse. "Defibrillator ready," Marcus shouted. "Wait. First I need to stabilize Patricia's cardiac output." Elena was performing surgical procedures while looking at Harrison. This was like that night in Afghanistan. 5 wounded soldiers, 1 Elena, minimal equipment. But that night, she had saved them all. 200 joules to Harrison, Elena shouted while placing Patricia's final suture. "Shock!" Dr. Harrison's body jumped. Sinus rhythm returned, Chin shouted. At the same time, Elena was completing Patricia's final bypass connection. Patricia's coronary flow restored. 3 hours and 45 minutes later, something incredible had happened. Elena had saved both patients. Patricia Lynch's heart bypass surgery had been completed perfectly. Vital signs stable, heart rhythm normal. Dr. Harrison's heart attack had been stabilized. Thanks to CPR and the defibrillator, his heart rhythm had normalized. "Both patients stable," Elena said while removing her gloves. She was covered in sweat, but there was a light of victory in her eyes. Marcus was crying. "Elena, how did you save 2 people at once?" Dr. Chin just stared. This is a performance that should be in medical literature." Elena knew it was time to reveal her secret. Dr. Chin looked at Elena in shock. "Elena, you're a nurse, not a cardiac surgeon." "I know what I'm doing," Elena said while putting on surgical gloves. Marcus screamed in panic. "Elena, this is heart bypass surgery. You can't do this." But Elena had already begun organizing the surgical instruments. Her 10-year field surgery training had automatically kicked in. This was her expertise. "Dr. Chen, apply CPR and provide emergency medical support to Harrison. Marcus, keep surgical instruments ready. I will save both patients." While Elena monitored Dr. Harrison's condition, she also focused on Patricia's open heart. Multiple blockages in coronary arteries, damage to heart muscle, complex reconstruction needed. "Dr. Chen," Elena said while looking at both Harrison and Patricia, "I won't lose either of them." Elena took the scalpel in her hand. After 10 years, field surgery training was reactivating. But this time, it wasn't just one patient. 2 lives were in danger. Continuing Patricia's coronary bypass, Elena said, "Marcus, suction and retraction. Dr. Chen, monitor both patients' vital signs." Elena's hands began working with surgical precision. While repairing Patricia's heart, she was constantly monitoring Dr. Harrison's condition. "Harrison's pulse is stabilizing," Dr. Chen said, "but still unconscious." "First bypass graft completed on Patricia," Elena said, starting second vessel access. This was the multiple casualty management skills she had learned on the battlefield, managing multiple critical patients simultaneously, optimizing resource allocation, determining vital priorities. Marcus watched in amazement. "Elena, how are you managing 2 patients at once?" Elena didn't answer. That night in Afghanistan came to mind. After a bomb attack, 5 wounded soldiers simultaneously. Minimal equipment, maximum expertise, all saved. "Dr. Chen," Elena said while coordinating both patients, "watch Harrison's heart rhythm, intervene if there's arrhythmia." 2.5 hours later, Elena had delivered a magnificent performance. Patricia Lynch's heart bypass surgery had been successfully completed. Dr. Harrison had also been stabilized. "Both patients stable," Elena said while removing her gloves. Dr. Chen couldn't believe it. "Elena, this is an incredible performance. How did you manage 2 critical cases simultaneously?" Marcus was still in shock. "Elena, you're a real surgeon." Elena knew it was time to reveal her 3-year secret. "I served as a U.S. Army field surgery specialist for 10 years, Elena said. Multiple trauma management, battlefield surgery, saving multiple patients simultaneously. The next morning, there was major change at St. Catherine's Medical Center. Elena's story reached hospital management. Chief Medical Officer Dr. Williams called an emergency meeting. Elena, last night's performance was extraordinary, saving both Dr. Harrison and Patricia Lynch simultaneously. Thank you, Dr. Williams, but you need to learn about my real identity, Elena said. Elena explained her situation. 10 years of military surgical experience, battlefield surgery expertise, multiple patient management, combat surgical leadership. Dr. Williams was amazed. You're our hospital's most valuable asset. Would you manage the emergency surgery department? Elena hesitated. I prefer to stay in patient care. The families of Patricia Lynch and Dr. Harrison came to the hospital when they learned about Elena's story. Ms. Rodriguez, said Patricia's husband. I don't know how to thank you for saving both my wife and Dr. Harrison simultaneously. I just did my job, Elena said. After Dr. Harrison recovered, he came to Elena. Elena, that night you saved both my life and Patricia's. You're a real hero. Dr. Harrison, we're all a team. We protect each other. Elena still works in the same nursing position at St. Catherine's Medical Center. Patricia and Dr. Harrison have completely recovered and returned to their normal lives. One day, hospital director Davidson asked Elena, do you ever regret leaving your great military career? Elena watched the team working in the operating room. They were providing surgical care to patients, saving lives. No, Davidson. I protected soldiers for 10 years. Now I protect civilians. Same mission, Elena pointed to the patients. Yes, the life-saving mission never ends. Only the location changes. Elena's story isn't just a heroism story. It's also the story of surgical expertise finding meaning in civilian life, the instinct to serve, and never giving up. Because sometimes the greatest surgeons walk hospital corridors as nurses to save lives. Real healers change their uniforms, but never their missions.